So my topic is how to approach pediatric sleep studies. Next slide, please. So the learning objectives. So in today's topic, I'll be talking about how to approach the pediatric study systematically. So every patient we deal with is a new, especially kids, and they require special care. So it's very important to deal with them in a systematic and child-friendly manner. So we'll discuss various techniques in this presentation as how to handle them. And then we will also identify various setup challenges that we find during when we conduct the studies. So like we see during the setup procedures, like all the kids, they behave differently. So they don't let you put the electrodes. So there are quite few challenges that we face. And then we'll also discuss to improve the patient and caregiver experience. We'll go through different techniques that improve both the patient and the caregiver experience, mainly reducing their stress and anxiety. Then we'll also talk about how to apply evidence-based interventions. As research has shown that improving preparation, communication, and environment increase patient satisfaction dramatically. And it also tells us like small practical interventions can have large impact on the outcomes without requiring extensive resources. So next slide, please. Introduction. So as we know that pediatric polysomnography requires an overnight stay in a setting that is unfamiliar to both the child and the caregiver. So children, like adults, may not sleep normally in a strange lab environment with a bunch of wires around them. So they result in lower sleep efficiency, which can affect results. Many children who are asked to undergo PSG are medically compromised and may require multidisciplinary approach. In addition, we often see caregivers of such children are already considerably impacted by their needs. So it is very important for the sleep lab to provide care in a way that best serves patients and provide a wider impact of creating a patient and family-centered approach to pediatric PSG. And it is also very paramount that sleep labs aim to create a kid-friendly environment that is accommodating for both the patients and caregivers, which we will be discussing in the upcoming slides. So why pediatric? Pediatric polysomnography, it requires a lot of patience and preparation. So patience is of utmost importance while we deal with kids, as kids require more time to set up than adults. Sometimes children start crying and pulling the wires and sensors in the setup room, which may further extend the setup times. At this point, the technician should remain calm and try to distract the patient with the help of their parents. So along with increasing the setup time, it also affects the child usual bedtimes. It also happened to me like many times while we are doing the setup in the setup room, kids will let you put the wires inside the setup room. But as soon as they enter the room, like due to some anxiety, stress, they're not able to tolerate the wires and they pull all the wires out. So it is like more of time consuming because we have to put all the wires again. So being calm and putting yourself in patient shoe at this point is very critical. Next slide, please. So why pediatric PSG is challenging? There are various reasons that make pediatric sleep studies challenging. First is unfamiliar environment, which causes anxiety. So also we have already discussed sleeping in a lab setting can be frightening, leading to poor sleep quality and potential inaccuracies. It is often termed as first night effect. They may experience reduced total sleep time, lower sleep efficiency, and reduced REM sleep. So, sometimes, white scrubs that we wear during setting up the patient may also increase to the anxiety. Second is low tolerance and cooperation. So, children often struggle with the extensive, uncomfortable, and unfamiliar sensors. Example, EEG leads, especially the nasal cannula that we put inside the nose, thermistors. So, they are very low, like they have very low tolerance to these kind of equipments that we use. Next is technical and physical constraints. Please go back to the, okay. So technical and physical constraints involving smaller anatomy, especially we see with the kids, like they have small anatomy, small faces. So we have to deal with them accordingly. So Children have less consolidated sleep, often requiring increased labor intensive adjustment by the technicians during the night. So, high rates of cannula failure occur due to displacement, like they take out the cannula, or there are some like nasal secretions or mouth breathing, which is uh, commonly seen in the children. So, third one is behavioral and developmental factors. So, children, particularly those with neurodevelopmental disorders like autism, AHD, ADHD, trisomy, those kind of children are very difficult to tackle with. So, they may experience like more of anxiety and have heightened sensory issues that make the hookup challenging. And sometimes, with such patients, the entire hookup is to be done inside the room while they fall asleep. Next is the age specific considerations. So we will be discussing about the three main age groups. First is from birth to like 2 years of age. We basically don't deal with this age group in the sleep lab. So these kind of children, they require much intensive care. So these studies are mostly done in the hospitals. So in the sleep lab, we basically deal with 3 to 5 years, that is toddler or the preschool children, and 5 to 18 years of age, that is school age or the adolescents. So, next slide. So, talking about 3 to 5 years of age, this age group patients are one that mostly we encounter in our sleep lab. We basically deal with this age group. So, this age group patients require and need a lot of care while dealing with. Introduction and communication for this age group should be initiated by the sleep lab prior to the scheduled appointment. So they should be mentally prepared before they come into the lab, like what is going to happen with them, like we are going to put all the wires on them so that they are already prepared. So it is very important for the technician to establish a bond with these age group children and gain their trust. The history of seizure, enlarged tonsils, adenoids, and sleep disorders associated with behavioral problems are commonly seen with this age group. It is appropriate for sleep facility day staff to assist in properly preparing the child by giving tours of the sleep lab and then in supplying a video for what is to be expected. Then understanding normal development and behavior is useful in providing individualized attention in age appropriate manner. How a sleep technician present themselves to the patient, particularly of this age group, influence the behavior of children, particularly in regards to the study. So next we'll talk about 5 to 18 years of age. So this age group appears similar to adults, but there are certain differences that needs to be considered. Observation and behavior for this age group is very critical. By being observant, perspective, and empathetic, the sleep technologist should be able to develop a cooperative spirit and obtain good quality recording. For example, if you feel the child is looking down, he's not talking to you, and he's like avoiding the eye contact, you may assume that he's not happy with like what's going to happen with him, or he might not be happy with his parents that they brought him to the sleep lab for the test. So being observant at this point can help you tackle and cope with this kind of situations. Keen observation can help technician recognize their behavior and help them console. Respecting their privacy, especially for 15 to 18 years, is very important. Like, for example, before you enter their room, you should knock so they feel a little comfortable and gain your trust. Children in this age group ask a lot of questions as well, like you may see while you're doing the setup, they keep on asking you like what is this wire for. So it's like very important to engage in their conversation and answer all their questions whatever they ask, so that they are more comfortable and get used to the setup process. So sleep technologists must be willing to answer their question and let them participate in the hookup process. Participation provides a sense of control to reduce the anxiety about the testing procedure. And then understanding normal development and behavior is helpful in providing attention in an age appropriate manner. So what to expect during the test? So it is very important to prepare child before the sleep study. It can be intimidating, but understanding what happens during the test can help reduce anxiety and increase the compliance for both the parents and the patient. So it should be explained to child beforehand that overnight evaluation would involve gentle painless sensors that monitor their breathing, their sleep pattern, heart rate while they sleep in simple words. Like no technical terms should be used, like for example EEGs, EOGs. The child would not be able to understand that. Instead, we should go for the simple language. So and then showing them the videos of procedures so they are familiar with it. Most children will adapt well to the environment, but some will require some extra interventions. So understanding how a child is to be supported during the sleep study helps ensure the best possible experience and more accurate results. Next slide. So what are the common setup difficulties that a technologist faced during the night? So first is the refusal of electrode. So when the child entered the clinic, you can, from that point of time, you can make out like whether the child will cooperate in putting the electrodes or not. So based on that, you can just make your evaluation, like what steps you can do while you're doing this setup. So especially the children with neurodevelopmental disorders may require some extra interventions. Then is pulling sensors repeatedly. So while you're putting the wires inside the setup room, children, they don't keep the, like they're not still every time, they keep on moving on the chair. So they will keep on pulling the sensors. So at this point again, the technologist should be calm and continue the process. So then is crying and agitation. Younger children tend to cry and get irritated quickly. So it's hard to put electrodes and sensors and require more of like the time and interventions. And sometimes extra assistant like other technologists may be required to help in the procedure. Next is the movement artifacts. So it happens during the night when the child is sleeping. So as we know that children, they keep on moving, they have body pains, like the growing pains. So they keep on moving and twisting, turning the whole night. So it's very important for the sleep technologist to make the keen observation, documentation during that point. So and also make sure like all the wires are working properly by fixing them in a timely manner. Next slide. So, what is the approach framework that we need to conduct a good sleep study for a pediatric patient? So, we will be discussing the three different approaches. First is before the study, which will include preparation and education. Second is during the study, like it's basically dealing with the technologist that he or she should make the rapid with the patient during the setup. And then after the study is the reinforcement. Next slide. So preparing the child for the sleep study experience. So preparation is the key to successful studies. So beyond describing the details of polysomnography in clinic visit, it is important to provide families and their children the opportunity to tour the sleep lab before the study. Children should be encouraged to bring their normal clothes, stuffed animals, blankets, even pillows to make night more like sleeping at home. So ask the parents to maintain normal routine during the sleep study day. Like for example, avoiding the naps could help. So if the child has already slept like 8 hours at their home, so they will not be able to sleep in the lab. So it's important to monitor their routine during the day. So ask the parent to maintain normal routine. And then parents are also need to prepare themselves emotionally. Sometimes child will let you do everything, all the wire placement is done, but all of a sudden parents say, oh, it's like how the child will sleep with all these wires. All of a sudden the child will start, he will get agitated and pull off all the wires. So it's very important for the parents to be like emotionally stable and help the technician in the whole process. Next is so this we have already discussed preparation strategies. Next, we will be going through the visual and behavioral tools. So, for example, like telling social stories, some making some stories to the children can help them understand the way in a better way. First, then boards build the structure, and visual schedules reduce the anxiety, and also improves the compliance, during the sleep study process. What happens when you arrive at the center? So understanding the check-in process and initial setup reduce anxiety and set appropriate expectations for evening ahead. Most sleep centers are designed to feel more like comfortable hotel rooms than the medical facilities. Introduction of sleep technologists is very important. Sleep tech will introduce politely to the parents and the patient and head the patient towards the room, showing all the necessary things. Sleep technologist roles matters the most here. It is where It is at this point the sleep technologist can build the confidence with the child. So he or she should try to develop rapid with the child and be friendly. Sleep tech dealing with the pedia patient should wear colorful scrubs that could reduce their anxiety, as white coats make them more like they will not be they will not comply with the treatment. So sleep tech should explain the procedure and visit the patient's rooms frequently to increase the familiarity, increasing both the child and the parents trust. So next is electrode application. It takes careful planning and diligence. So uh, during the setup process, it should be like the sleep technologist should be more careful while doing the setup. Next slide, please. Environment optimization. So child-friendly rooms should be there. There should be less noise and lights in the room. So, and also the temperature should be maintained like too little lower, as it's more comfortable and it induces sleep. And child can also bring some familiar items from their home like toys, pillows, blankets, as we already discussed. Next is process of attaching and monitoring equipment. So it is where the sleep technologist matters the most. Setup process involves attaching different sensors to monitor different aspects of child sleep and creating and sleep and breathing, sorry. Understanding what each sensor does help reduce the fear of unknown. So sleep tech should try to explain the process and show the equipment beforehand so child is already familiar with it. Electrode application should be gentle and painless. The sensor feels similar to stickers, so it should be explained to the child that sensors are just like the stickers and does not cause discomfort when applied or removed. Setup process typically takes like around 30 to 40 minutes depending upon the cooperation of the child. So it is important to engage the children in conversation or some games to make the time pass more quickly and keep them relaxed. Little demonstration on parents or toys could help ease the discomfort. So next we'll discuss about some of the distraction techniques. So these includes toys, videos, sensory tools that can be kept in the setup room to just distract the children. Light up or interactive objects. Then storytelling. As I told you, you can just make up little stories so that they get involved and just help you comply with the setup process. These all things will reduce the anxiety and improve the cooperation. So tips of improving cooperation. So younger children are difficult to handle, so needs cooperation. Some children wants to get setup done while sitting in their parents' lap, so it should be allowed, or holding their hands. So it should be done if they let you put the wires, you can let them sit in their parents' lap. Then is the medical play. Medical plays, it may be beneficial to put few wires on the favorite toys as a demonstration, or you can also put some wires on the parents just to show the children that it doesn't hurt and it's painless. Then older children, for instance, they like their siblings may help to hold the electrodes, or just you can just put some of the wires on them so that the child is cooperative. Next slide. So this is very important, the role of parents. So parents have a very crucial impact on the success of the sleep study. It's cooperation of parent during the study is a asset to the sleep technologist. Not only parents assist the sleep technologist in placing the electrodes, they can also provide some additional information describing the child's sleep patterns and other notable behaviors that can aid in sleep study. Parents can also help improve cooperation of their child while the setup is being done by distracting them and engaging them in conversation, ultimately reducing the anxiety. So, therefore, parents are encouraged to stay overnight with their children. They can also help in bedtime routines of the children, and and also assist and communicate with the sleep technologist during the night. Like sometimes the parents can let the technologist know that cannula is out if the technologist is busy with some other patient. So they are like it's of very much help during the night. So it is also important for the parents to stay calm and positive throughout the process and act as a role model for their children. If the parents will like feel little emotional, so it's going to directly affect the children during the sleep study. Next slide, please. So this is very important again, the technologist role. So sleep technician is the real hero during the night study for the children. So it helps in the successful completion of sleep study from the entire process of receiving the patient, hooking them up, and then removing the electrodes in the morning. So it is important for the sleep technologist to be calm and patient throughout the night, as we discussed earlier. Tech should adopt adapt to in a very child friendly manner with the patient, and various creative terminologies and techniques can be applied to make the patient feel more comfortable and to run the study smoothly. It is very crucial to ensure a secure hookup for the child to ease and make them comfortable during the night. So next we'll be discussing various interventions that can be done to make the pediatric studies more successful. First is the family-centered approach. So sleep labs should work on creating a family-centered approach. Children and parents both should be given considerable children and parents, they should be both should be given the considerations. Safety and need is critical factor when children are involved. So procedures should be conducted to create the best of the studies. And then test environment should be inviting and child friendly. Psychological preparation of the children and parents are fundamental to the procedure. So providing detailed information that could be beneficial beforehand. Testing should be scheduled in regards to child's usual bedtime. So communication also plays a vital role in enhancing the family-centered approach by letting the parents know the logistic of reaching the center, what to bring, like the food or some transitional objects, and ensure all the concerns and questions are answered appropriately. Then separate waiting area for the pediatric patient should be made. So the environment in the waiting area should be child friendly again. There should be separate waiting area for children, as seeing the older and ill appearing adults can affect the child's mood, and it could lead to complications in the sleep study for the pedia patients. Parents should always stay with the child, and there should be a comfortable accommodation for parents, including bed in the same room and shower facilities. Child bed should be age and developmentally appropriate. For example, crib for a very small child. And then, if in case like during the night, you parents tell you that child moves a lot during the night, or he's like very restless, so you can add the bed rails as we do in our lab. So the room should be made ready before the arrival of the patient. It's not like when the patient is in the sleep lab, you start preparing for the room. So everything should be ready before the patient comes to the clinic. Next is the psychological preparation. It is again very important to psychologically prepare the child prior to the sleep study. It often starts with the clinician who ordered the referrals, explaining the procedure and reason for the study details. Then it is reinforced during the scheduling process, where parents are reminded the procedure and allowed to ask questions. A visit to sleep lab, as I told you before, is very important for or a tour prior to the sleep study can be very helpful and easing the anxiety associated with the sleep study. Then staffing and lab hour modifications. Staffing and lab hours might need to be extended for pediatric PSGs. As children, they go to bed little earlier than the adults and needs more sleep. The technician should partner with parent and child during the setup and engage child as much as possible by assigning roles, giving choices, or encouraging age and developmentally appropriate coping strategies. So each step of the hookup should be explained to the child beforehand. Next is the distraction box. So every lab should be equipped with a distraction box, consisting of some toys, stickers, books that can be used during the hookup to just distract the child. It would improve cooperation and reduce the setup times. And having the child watch a video or play a video game during the setup process can be another way of distraction, but it is not a good sleep hygiene. And then least invasive techniques. So technicians should place the leads in least invasive way, giving child the prioritization. So child should be allowed to sit in parents' lap, as I told you, if they are more comfortable there. Instead of hookup proceeding from head to toe, the least intensive wires should be put first. Like, for example, you can put the leg electrodes first rather than starting from the head EEG. That's like more complex and would agitate the child. And then the nasal cannula uh, is the most important, like the most important sensor that disturbs the child. So it should be done in the end, or it's recommended to put after the child sleeps. And then continuous praise and appraisal. So a lot of praises and smiles should be given throughout the like the hookup or throughout the sleep study process, I can say. Like next slide, what happens after the study is done? So after the night study is completed, it is important to understand the post study process, as it helps to know what to expect and have how quickly the results might be received. So like for example, in our lab uh, we usually give the card to the patient where the appointment date for the test results to be discussed are given. So it's important, very important, to tell the parents like what's going to happen after the study is done. And equipment removal should be in the morning, it should be quick and painless so that the child is comfortable. So what are the various domains of improvement? So first of all is the staff training. It's very important to provide empathetic communication training to all members of the team, including the technologists, desk staff, nurses, and providers on regular basis. Brainstorming process should be multidisciplinary and allow sleep tech to discuss the needs for further training and in caring of children and caregivers. Special training should be provided to how to handle difficult patients in the lab. It is necessary to set expectations and goals for all the staff members in the lab. Next is the patient education. Parents and caregivers should be educated on what all is expected during the study. Patient appointment guidelines should be made and updated on the regular basis. Frequently asked question documents should be created in all the labs, and informative videos should be made available from the kids' point of view, so that the anxiety is reduced and it's in the easy language. Next is the environmental design. So child-friendly environment should be created in the lab and reduced co-mingled rooms, offering tours. Then smart approach is to enhance and upgrade check-in process by offering check-in bags. Uh, like there should be check-in bags when the child enters the clinic, having certain items like toys, so that they feel little comfortable and friendly. Patients, especially children and parents, should be made to feel like guests, not like the patients. And basic amenities should be made readily available, like shower facilities in the lab, so that the parents and children, after the wire removal is done, so they can just clean up themselves. And like a refrigerator in the sleep lab should be there, where the parents can keep their food for the child they bring, and then also store the medications if they're required. And then small chairs, books, or artwork should be initially initiated for the or installed for the kids in the sleep lab to provide a friendly environment. So last is the communication. So it is very successful in sleep study. So empathetic communication should be implemented amongst the staff members. Staff should be polite who are dealing with especially with the kids. And like there should be access to child life specialist in the sleep lab. So along with the above domains, there should also be flexibility of rules. Flexibility of rules means like if a child, like a parent wants to stay with the child, he or she should be allowed to stay. Like if two parents are not allowed, at least one should be there with the child throughout the night. Next is the reward system. So rewards can help motivate children to improve the behavior. Praising the child after successful completion of the study is very important. Technologists can give reward in the form of like stickers, some paint colors, some soft toys, so that child is calm and like he feels happy. So next is the outcomes. So all the strategies mentioned above will minimize the burden of polysomnography for the children. It will also boost the confidence of the sleep technologist, especially if proper training and ongoing upgradation of procedures are and policies are there in the sleep lab. It will also have direct effect on the improvement of quality of the study and further diagnosis and interpretation of the results. Last but not the least, it will increase the patient and family satisfaction, which will directly impact the future referrals. So, to conclude, I would say pediatric PSG is a gold standard for diagnosing sleep disorders, but faces significant challenges as mentioned above due to limited access, high cost, and difficulty in tolerability for the children. Sleep studies represent an important step towards helping children achieve better sleep and improve overall health, and, and can also improve the quality of life dramatically. While the process might seem daunting initially, but through combined efforts of family physicians, sleep specialists, sleep technicians, and parents, the experience can become more manageable than expected, resulting in thorough evaluation and coordinated treatment. So it is important to understand that children require child-friendly atmosphere and approach needs smaller and specialized equipment due to developmental and psychological differences from adults, having age adjustment rules for diagnosis and interpretation. So that's all from my side. Any questions, you can feel free to ask, please. Thank you and have a good evening.
Any questions from the audience? Check online as well if there's any questions for any of our topics this afternoon. Your comments online just to say thank you. Great talks. Great. A question for you, Raman, if you can hear me okay. Could you comment on some of the specialized populations we see, some of the kids that can be more, let's say, challenging? You alluded to it in your presentation, but some of the conditions we see in our lab with kids that are more complicated.
Yeah, sure. So, as I've worked mainly with children with autism, ADHD, and then there are few children, those who are not able to walk, they're not able to respond to the things. So it's very challenging to do the setup for such kind of patients. So they won't let you put the electrodes in the setup room. All the thing you can do is once they sleep. So it's really challenging to put all the wires once they sleep, because the one side you will put, the other side they will not let you put. So there is a limited access to the sensors, the electrodes, but still with the scorers, they're able to score the study with the few channels. So it's very hard to deal with such kind of children. Yeah.
Yeah, great. Yeah, I was going to think of that as well. We don't have any specific limitations in the kids we see, although the more complex kids, may need a tertiary center. But, we do see lots of kids with autism, Down syndrome, as you heard today, is a common population with sleep disordered breathing. I have kids who have neuromuscular diseases. It was a good comment, Raman, that you said they may not be able to walk. And so we think about stepless access to our rooms, to a sleep lab, making sure there's an elevator to come up floors if you're on a non-ground floor. We see kids with Angelman syndrome, Prader-Willi syndrome, all sorts of genetic syndromes that come with sensory challenges and physical and mental difficulties. So I think that's really important. I wanted to make a comment that I am so thankful for our pediatric technologists, all of our technologists. You mentioned you have to be patient, you have to be calm, you have to be creative. That applies for us as pediatric providers, but especially for our pediatric technologists trying to get these kids sleep overnight. I do read the comments from the PSG forums in the morning. We ask about the